What makes me put a smile on my face is helping people and seeing patients who were happy with the way I took care of them and are happy with the end result. My name is Dr. Gary Simon. I'm a board-certified orthopedic surgeon specializing in the field of sports medicine. Patients come to see you because they have an orthopedic problem that obviously they're concerned about. So you always have to put yourself in their position because they've been looking forward to coming to you to get an answer or to at least get an understanding of what's wrong and what they could do to get better. I think if you establish that as a baseline and go through it from their point of view, you're on the road to success in having a good, healthy patient-doctor relationship. I trained in orthopedics for 5 years, but I also did an extra year, it's called a fellowship year, just in evaluating and taking care of patients both in an operative and non-operative fashion, patients who have gotten injured in sports medicine type environment. Certainly you always think of sports medicine as the football player, the basketball player, the soccer player, the gymnast, the wrestler, but it's really just any active person. Most sports medicine injuries tend to be knee and shoulder injuries, and as a result, most of the patients I see have knee and shoulder complaints, injuries, ailments. I am from New York, and I did all my first 30 years of my life studying in New York. I married an Atlanta native, which is actually how I came to Atlanta, and have 3 boys. I'm very active with my family. Personally, I exercise every day. I enjoy reading, I enjoy traveling, which I try to do in my not-so-spare time. Orthopedics is where I saw myself for many reasons. Number one, having a former prior athletic background attracted me to athletes and injuries. Having had shoulder surgery and knee surgery myself gave me an increased insight into the field of orthopedics. And then when I did my various rotations throughout school, I saw myself being able to help former athletes and people with injuries get back to an active lifestyle and cure them of the problem they came to see you for. The nice thing about the field of orthopedics is always changing. There's always new techniques, new innovations, new engineering of different products in order to try to best help our patients. And you're always learning. And it keeps you active and it keeps it exciting. I think what's most important to me in taking care of patients is that patients think of me as their partner in trying to get them better, and having a patient say thank you, or knowing that a patient got back to the activity that they want, gives you that sense of self-satisfaction that we all look for in our everyday life, in our everyday job. And I think that if you have an internal feeling that you've helped people and they appreciate it, that makes it worth waking up every day and going to work.